Victor, warm welcome to the Good Growth podcast. How are you?
I'm all right. So far, so good. Yeah, I'm okay. Yeah, seems we've
Excellent.
got interesting backgrounds. You appear to have a forest behind you,
I do indeed, and you seem to have, well, quite an assortment. A lot of red.
a junkyard behind me. Yeah.
So I want to delve into some of the work and success that you've achieved through your career. But before we do that, I suppose throughout all of your work, there's a theme or something or it's been underlined, I suppose, by a clear passion for tackling health inequalities in the community and within voluntary
Inequalities generally,
organisations.
actually, but yeah, inequalities
Can
generally.
and can you tell us a little bit about where that passion and drive to tackle those issues came from?
Well, to be honest, I was thinking, like the standard answer I give is that my mum was a nurse. I grew up in Wakefield. We weren't rich. In fact, we were quite poor. And what else are you going to do? But actually, the real truth is that the logical. I have thought about this a lot, and I often the logic answer is, what else are you going to do? What kind of person comes onto the planet to make the world less equal? Right? Now, there are people who do that, but why would you? It's a strange thing to set out to do, right? To make the world less equal and not to care about inequity or inequality. What kind of a person does that? Right? It just seems an odd way to live. So it seems the answer to the question is it's logical. It's illogical not to.
Was there any particular moment when that sort of drive and desire developed? I mean, like you say, it's a logical thing to do from
To
human
me, it's a
instinct,
logical
but
thing to do. I'd love to have the debate with somebody who thinks it's illogical. There are people who do think it's illogical, but they tend to avoid people like me, I guess. But I don't know. I was probably quite young, actually. I mean, it just seemed, you reflect on your life, and I do, to understand what you're doing. I was probably about 12 or something. I mean, just thinking about as you do when you're walking across the park to school, and you think, well, what's the point?
yeah.
What is the point of my life? What is the point of it? Right? What am I doing?
So it's really,
And what do I want to do? And how do I want to feel about what I'm doing?
yeah.
And one
Well,
comes to some obvious conclusions.
so I suppose from a personal perspective or perhaps a selfish perspective, it's just to make that feel like you've made an impact, I suppose, on
Well,
society.
yeah. There's lots of ways to make an impact on society. One is to wipe out half of it. The other would be to. There's lots of ways to make an impact. I guess I decided, like most normal human beings, to make a positive impact or to try to. I mean, I'm not sure. People say, I'm a bit cautious about words like success or impact because I'm still alive. I don't know. I don't know whether I've made an impact. I just do. People. I like to think I just do my best. Hopefully, I have, but I've got no idea, frankly.
Well, I think the proof is in the pudding from what you've done so far.
Well, yeah, but yeah, it's an odd thing. People, yeah, I'm not sure. I like to think that I've left things better than I found them, and hopefully I'll leave the earth better than I found it. But I haven't left yet, so let's see. you know,
Plenty more to do.
yeah, yeah.
So let's start then with the present day. You're currently working with Visionable,
I am. I'm the co-founder and chairman of Visionable,
co-founder and chairman of Visionable, which
which I'm very proud of.
just for a bit of background for the listeners is a platform that's really sort of innovated how health services are delivered, particularly during this time
Yeah,
when face-to-face contact is limited.
yeah.
Over to you, really. Can you just tell us a bit more about
We've
Visionable?
been myself and my co-founder Alan Lowe have been working on Visionable for some time now. It's different from other video. We're talking on Zoom, and actually Visionable could have been Zoom, but it could do much. It can do much more than Zoom, and that's partly the challenge that we've had. It can do everything, so you could replace your whole corporate communications with Visionable. Basically, it's secure. It can do things like multi-camera feeds. It has this thing called lossless vision. So what you see down if it's a cancer cell, you see it on your screen. It's security, so there's no, it can't be hacked because we don't hold data. It just the data's in. It's all that sort of stuff. So these things can't be done by other platforms. But we focused on health for the last 5 years and a bit longer. We focused on what it can do in health, and what it can do in health is um, things like stroke. So we've been focused on stroke for the last year or so, and we run the East of England Stroke Network, and we know, because we've had the research done, that the average number of beds, time spent in hospital in bed after following a stroke in East of England was about 17 days, and we've reduced it to 2. We have the average, the percentage of people being thrombolyzed, which is the response when you have a stroke, was 1% before Visionable. It's now 40%, and we've saved the system, I think, about 19 million. So our response is, well, everybody should get that. Everybody should get that service, and the fact that they don't is something that we set out to change. So Visionable is we're a vision-driven company, a values-driven company, and we're set up really because we believe there are only 3 problems really facing health pretty much anywhere in the world: equity, which is not the same as equality. In London, a woman in Barking and Dagenham, which is a poor area, has an active life expectancy of 55. In Richmond upon Thames, which is a rich area, it's over 70. That's equity. Right? They need different things. Access, by which I mean the means by which we design services, deliver them so that they are accessible, which is a challenge, and digital. And if digital isn't helping you with the first 2, why are you using it? Right? So Visionable is the digital that helps you with the first 2. And so we're picking pathways, condition pathways, stroke being the first. And we're effectively, as my friend and business partner says, we're putting it in a box. We're basically creating a pathway which is supported by Visionable, which means that anybody, anywhere in the world, effectively, can get a stroke diagnosis. And can get treated. And it's not just stroke, we can do this for any ischemic event or any condition. And in fact, in the access point, one of the things that Visionable's working on, we can do, is connect you sitting there with a clinician anywhere in the world. And one of the problems is shortages of specialists is a problem in most health systems. And that issue is as much about the numbers available, but the usage, the utility of the ones that, of the specialists that you've got. So if you've got a specialist sitting home twiddling his thumbs when he could be talking to you, dealing with you, that's a waste. So we have our platform can enable that to happen. It can connect the clinician with you, enable the clinician to see everything there is about you on one screen, talk to you, deal with you, indeed operate. And we can do that while you're in an ambulance on the way to the hospital, because our platform works with 5G, which is pretty unique. And it also, sounds like an advert, but it is pretty slick stuff. Our platform also works with AI. So because it's multi-feeds, you can have different AI streams, different pieces of information from different angles about... So if you're an AI platform provider, if you do AI, the more data you're feeding from different sources, the faster your algorithm learns. So we're talking to a number of companies now. I nearly said which ones, but we're talking to a number of companies who are very keen on AI, because our platform is the only one that will do that and feed multiple streams. So there's lots of things it will do, and we are really excited about its potential. And I think it could change the way healthcare is delivered.
It is, it is an incredible piece of digital innovation that probably the health service has been crying out for. It sounds like
it is, and it has been crying out for it. We are now in there's about 20 top hospitals in the UK, and we're in nearly half of them. We work with about 100 NHS organisations, and we haven't been going that long. I mean, 4 years ago there was 2 of us, then there was 3, and now there's 70 of us. So we've been growing at quite a pace. But my view is the NHS is actually one of the hardest systems to work in. It has a lot of pilots, a lot of innovation, but not much spread. It's
Right.
very hard for all kinds of reasons. And so our proof of concept is Visionable works in the NHS. That means it can work anywhere. It'll work in any system because the NHS is one of the hardest systems to change pretty much in the world. It's a really hard system to change because of the way decisions are made, because of the way the internal health market operates, because, and we've managed to do it because what we do works and is reliable. So we are talking to partners in the US because the US has a very unequal, high cost but low value health system, and we know we can make significant change. So next year is a big US year for us. So we're moving into the US as well.
Yeah, expanding beyond the UK.
We are, yeah, and Germany and Africa as well. So we think we can deliver an awful lot from our platform. In fact, not that we think, we know. So it's really exciting for me, for Team Visionable. This is like it's a game changer.
Yeah.
Our platform will sit underneath a lot of change, basically, in healthcare worldwide.
Sounds brilliant. And actually, just to move sort of back then to before Visionable, you were chief executive of Turning Point.
I was
for close to 20 years.
Yeah.
And during your time there, you led the transformation from what was a substance abuse charity that was more reliant on funding to what is now essentially a social enterprise that's self-fulfilling.
Yeah.
So why? May seem an obvious question, but why did that transformation need to be made?
It's not obvious, actually. It was quite hard. No, thank you for asking, in a way, because when I first arrived at Turning Point, it was very much the charity. In fact, it was one of the charities that Princess Diana was a patron of, and she dropped. And I'd been at Centrepoint before then, so my career had gone from point to point. And Turning Point was very much the charity. The problem with that was that we were losing money, a lot of money, like really, we're about 20 million, I think, but we're losing a lot of money. And the problem is that everybody expected us to deliver our services for free, and most of our clients were local authorities, and it was not sustainable. It's a very simple thing if you're in a charity. You're either raising enough funds or you're not. Your cost of raising those funds is less than it costs to actually raise them. You'll be making more money than it costs to raise the funds, if you see what I mean. And you have an efficient distribution. We were struggling, partly because substance misuse ain't sexy. It's hard to raise money in substance misuse. We also were doing some learning disability services, and a bit of mental health. So it's not that we weren't only doing mental, but I figured that strategy wasn't sustainable. So we had to do a number of things. One was start recovering the full cost plus for what we were doing, so we could make a profit. And we had to do that by shifting our stance from a charity to a social enterprise, a business. Now, this is, in my view, and your listeners may disagree with this, charities are businesses. They just don't have shareholders and they don't distribute dividends. I got into a lot of trouble with the charity world who felt, well, you're not you're a business, you're too business-like. And I'd say, well, no, we're a business. We're not a business-like, we are a business. And that's because our clients deserve the best. They don't, it's interesting, middle-class people, and you might be one of them, you probably are, don't generally, well, I hope you are, because it's not bad, they generally don't go to charities for their services. You think about it, they don't. And so my view was, why should people who were suffering from life-threatening conditions, who had life-threatening, challenges like substance abuse or illnesses like mental health or disabilities like learning disability, why should that be a charitable endeavour? And why should the fact that, Turning Point at the time ran a number of substance misuse services in central London, still does in fact, And I knew that if I closed those services on Monday, you would notice the difference by Wednesday afternoon if you walk through Soho. Why is that a charitable endeavour, right? That's business.
Mm.
so, so it was a long, didn't happen overnight. We needed to change the
No.
culture, change the funding, and become a social enterprise. And that's what we did over a period of, well, probably took about, I'd say, 4 to 5 years before we actually got it embedded. And by the time I left, that's what we were. I'd like to think that we're a leading light in the health sector as a social
Mhm.
enterprise, and hopefully we'll carry on doing that.
So I think you've briefly touched on it there. So what can Turning Point now offer to society that it couldn't when you first joined? What the kind of services?
So Turning Point can offer. Well, we're in the top 10 providers of forensic mental health. At least we were when I left, which was nearly a year ago. We provide, well, Turning Point provides learning disability services to probably over 2,000 people, and substance misuse services to probably about 70,000, 90,000 people in 300 locations, many of those in the poorest areas in the country, and employs, I think it's nearly about 4,000, just over 4,000 people doing that. It is in the top. It is one. So being big isn't as important as being good. So
Mhm.
we are in the top 2% in terms of quality and safety of services. Turning Point. I keep saying we, but I mean I'm no longer associated with it, and I'm glad because it was hard work. So,
Yeah. Yeah.
but Turning Point is in the top. I like to think that Team Turning Point, will continue to be in the top quality of providers anywhere in the UK in health and social care, according to the CQC, Care Quality Commission. Yeah, the answer to your question is we can deliver an awful lot to an awful lot of people that we couldn't have delivered, you know,
Mhm.
19 years ago, basically. So,
It's pretty extraordinary the transformation there from where you started to now where it is now, and the foundation it's got to hopefully continue to build on
the
those
trick
services.
is to hire really good people and let them get on with it.
I absolutely, and expand on that a bit more if you can. So I mean, is that essentially your leadership style? Is to have really good people and essentially, yeah, you've brought them in for a
You
reason.
don't hire people that are better than you at most things. I'm not. It's very interesting. People want to talk to me about what I've done in the past. At Turning Point, or what I'm doing now at Visionable, as though I did it all. I mean, I didn't. I basked in the glory of some brilliant people. You build. I built a team, basically. I mean, I appointed people who were smart enough to appoint smart people, and my job was to not get in their way, to lead, follow, or get out of the way, basically, and make the decision as to which of those was appropriate or whatever. But the lead thing, it's not about my ego. It's about where can I and where should I add the most value with what I know, and who I am, as opposed to constantly being in people's face because my ego demands that that's what it's got to be. So yeah, anything that I've done or will do that people consider a success is not because of me. It's because I've surrounded by some bloody good people, basically, who believed me for long enough to actually, deliver on my behalf and allow me to bask in their glory. I mean, it's great fun when it works like that. But I just feel a bit,
Yeah.
they 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 my job is to leave the place slightly better than I found it and not cock it up, not make it
Mhm.
worse. So, so far I've managed to do that, but it's because of other people.
Just on then your sort of broader life achievements and the responsibilities you had. So you became a member of the House of Lords 2001.
Yeah, I did.
Um, you've regularly featured on the power list, which for those who don't know is a recognition of influential people of African Caribbean heritage.
Yeah,
What do those sort of titles and response mean to you
not
in
much,
terms
to
of
be
your
honest. I'm
no?
always well. It's not, I never. I didn't set out to be a member of the House of Lords or to appear on lists. And
No.
actually, you probably know, the most powerful people in the world don't appear on lists, right? So in any setting. So I don't really have a lot of, It's nice. It's better than not appearing, and not in some ways for other people. For people who want to work with me, they kind of look at the list and think, well, he's not cocked it up so far, so he's worth having a chat with. Yeah, the House of Lords is an interesting one because I thought long and hard about that. I was encouraged to apply. I went for an interview, for like a job interview, and I was interviewed by people who, well, I suppose people talk about the establishment. I was interviewed by the establishment, right? Quite powerful people who are very subtle. The sort of people that I guess in some ways, if they sliced your arm off, you wouldn't know till you reached for your pint, sort of thing. Really, but that much to my surprise, shock actually, I got in. I was told that 5,000 people applied, and thousands of people apply every year. So people slag off the House of Lords, but it appears to be very popular.
Wow. Yeah.
So, having accepted it, I found myself a member of the most exclusive club in the world, and I'm not one of these people who it is fashionable there's a helicopter flying over which you might hear, but I'm not one of these people who it's fashionable to slag off the House of Lords or indeed the House of Commons these days. I think we should be very careful about doing both. But I'm not, I have a rule about the House of Lords, which is I only vote on things I understand. I only speak where it's going to make a difference. So I can tell you exactly how many times I've spoken, 39 times since I started. I vote. I was up last night on my computer voting on the immigration bill. Because I do actually think it's a really good idea that we allow asylum seekers into the country. I know that's not necessarily a popular view either with some people, but last time I looked, most things that are useful in this country have been built by asylum seekers or refugees, or indeed immigrants, and there is a difference. So I do vote on things that matter to me and that I think I know something about. So it's quite useful.
Yeah. And my final point, so I want to touch on the Black Lives Matter movement.
Oh, yeah.
And so that's received a lot of media attention this year.
Yeah.
In your opinion and view, what now needs to happen? So a powerful message has definitely been sent.
Well, there is there is a very strange moral equivalence that occurs around these issues where, a black person can be, well, literally murdered in broad daylight, horizontally lynched, and you do hear some people going, well, he was a criminal. As though somehow that excuses the fact that he was lynched in public. It's very odd. Or you hear people, well, on the one side, I would agree with the idea that Black Lives Matter, which is a neutral sentence, either Black Lives Matter or they don't, right? Or on the other hand, I'm not sure. I need to think about it. What is there to think about? What you saying? It's like, what? There is no debate, right? You either agree with the statement or you don't, right? If you don't agree with the statement, you're a racist. It's not difficult. It's right. Now, that's separate from the organisation. The organisation you can have a view of, and it's not really an organisation. It's a loose collective of things that happen. And so some things you might think are very useful, and some things aren't. I like the Ruth Bader Ginsburg's view, which is that you should try and make change, and you should create movements, but do it in a way that get people to follow you.
Yeah.
And that's how the civil rights movement worked in America, and that's how the civil rights movement worked in the UK. And you've got to remember that black people. I was born in 1962. Black people got the vote in America in 1964, and we got the Race Relations Act in this country at roughly the same time. So I just think, what kind of person wouldn't agree with the statement that Black Lives Matter. It doesn't matter whether you're black, white, yellow. Who cares, right? It's a simple statement. And therefore, if you see the evidence that Black Lives Matter, the lives of people like me matter less than the lives of people like yours, why wouldn't you support it? Why wouldn't? What's do you know what I mean? What side of the argument do you want to be on? It's not a difficult argument,
No.
and almost for me, it's not about race. I support the notion of Black Lives Matter because I'm human. It's as obvious as that. So I don't get the notion that it's a debatable point. If it's debatable, it means that there are people who don't agree with it, who don't agree that black lives do matter. There are movements, all lives matter, which is another obvious statement, which I would absolutely agree with. All lives matter, absolutely. But if you see a black man being lynched, and by the way, there have been other killings, that just happened to be the latest one, then it's also true that some lives appear not to matter as much as others, and they happen to be black lives, in which case you must agree with Black Lives Matter. Do you know what I mean? You can wrap yourselves in knots, but it's just obvious to me that we live in a world in which it is everyone's problem. It is everyone's challenge. No one can avoid it. It is an issue that will haunt you, whether you are black or white, if you are a human, if you are a decent human. If you wake up in the morning and think, actually, I wish to leave the world a little better today.
Yeah.
Or if you have children, if you care about your fellow humans, at any form, then you need to be involved.
Victor, thank you very much.
No problem.
For your time. Absolute pleasure talking to you about the Black Lives Matter movement there, but also, of course, your achievements and with Turning Point, and obviously all the best with Visionable. It sounds like there's some exciting times ahead.
Thank you. Well, I hope so. I'm a busy guy, but Visionable needs everybody's help, and so does Turning Point. So big up to Team Visionable, and big up to Team Turning Point.
Fantastic. Thank you, Victor.
Thank you.